assuming everybody's going to provide services, that we're now going to actually pay for services actually
and
rendered.
Track it, pay for the services
exactly.
that the...
And I think
well,
that if
you're
they
nodding to that yourself,
and if they
Christine,
show
nothing
that
wrong
they
with
spend, provide serious services, we at CARP would advocate on behalf of fully funding them and funding them properly if the services are provided. The danger here is paying for services that are not provided.
Fair enough. Christine.
And nobody disagrees with the audit. We want to all make sure that the money is going to be
We got to
well
track
spent.
these things. It's a lot of money.
Absolutely. But at the end of the day, what it's going to mean, because these professional allowances were meant to assist the pharmacists in order to be able to provide those services. Now with the allowances being yanked, this means that there are going to be some services that are going to be lost, because you can't take $750 million out and pretend that there are not going to be any negative ramifications. There will be. There will be pharmacies that are going to close. There will be pharmacies that won't be able to provide free delivery service, that won't be able to waive co-payments for seniors like they used to provide a whole host of other services that particularly will hit seniors, that pharmacists won't be able to do, because there is no way they can stay in business in order to be able to do that. And
nodded at some of that. Are you agreeing with any of that or some of it?
I think accountability is a really important thing. We have to know where the money goes. I have no problem with that.
Yeah.
I also hear that the stores are threatening to close and cut services and take care, to make people pay for home delivery and so on. And they are holding seniors to ransom. And I object to that heavily. Their fight is with the province. If they don't like what the province is doing, they can have their high-paid lobbyists go and try to get a better deal. But right now, they're sending cards home with seniors saying, quickly call your MPP because you will lose our services. That is a threat, and I think that's improper.
Okay, let's go to the phone and see what people would like to tell us. Here's Jack now. He's calling from Ottawa. Jack, what do you think about all this? Do you believe you're going to save some money in the future on generic drug prescriptions? No?
No, I think I'm going to have to pay more. I think I'm going to have to pay more for dispensing fees. And also, I used to get free deliveries from the pharmacist, and now I believe I will have to pay at least $7 for the delivery, courtesy of the Liberal government of Ontario.
But won't the drug itself be cheaper?
No, I
You don't think so?
No,
but,
no.
Well,
the price is going to be set cheaper.
Yeah.
There's no choice. The government actually will set the price.
But it'll be offset by the additional cost that Jack's talking about.
Well, these are retaliation measures by the drugstores. How much do they want to start charging for this kind of thing?
Ben Shanuda, go ahead, please.
This is not retaliation. This is the actual cost of delivering the service. Whether you get it from the $750 million professional allowance, you get it directly from the province of Ontario, or you get it from the patient, just think about it. This is the cost of doing the service. What's happening here, that the province is downloading the cost to the patient under very nice banner like we reduce the prices.
Right.
What's covered in the cost of dispensing the prescription? Why does it cost $14?
Because it does involve human being expertise like pharmacists, technicians, verification, system, monitoring of drug interaction, monitoring of the dose or the medication in association with the current
So it's mainly staffing. Is that what it is?
Beg your pardon?
It's mainly staffing, I say.
Yes.
Yeah.
It's staffing and the expertise, because you cannot.
Yeah.
Dale.
Yeah. Jack, go ahead.
Yeah,
you wanted to add something.
If I could, I'm on Ontario Disability Support Program.
Uh-huh.
And I get free delivery right now.
Yeah.
But under the new system, under the McGinty system, I will have to pay $7 per delivery.
You've been told that, I'm assuming, by your pharmacist, right?
Yes.
Yeah.
Yeah.
Well, that's hardly of much benefit then. You're going to have to scrape the money up from somewhere.
Well, it depends.
Yeah.
If the drug is $100 and right now, and you save 50%, you save $50 on it. That's net. Now, all the other, if the druggists want to start charging for delivery,
yeah, but the drug plan will pay for the cheaper drug. Jack's still left with the $7.
Well, this is so, and
you
the
know what I mean?
Is,
the government's not going to pay for that.
Why do the pharmacists say you have to keep our profit margins? If you look at some of the big chain published financial statements, their profits in the hundreds of millions of dollars. And a good lot of that are these professional allowances. Now, why are we obliged to keep that up for them. I am entirely sympathetic with the single proprietor pharmacists who can show their pro forma balance sheets and say, well, this is what we need to live and to stay in operation.
Ben, you wanted to make a point.
Yes, why it is always when we say the truth, the government or Susan go back to the big chain. I'm an independent store. What about me? What about thousands of independent stores in the province?
Well, there's really two different pictures, right?
I did really try to make that distinction.
Don't I have the right to make decent profit? Don't I have the right to put food at the table?
Sure.
Don't I have the right to send my children to university?
Yes.
What's wrong with that?
But
Okay,
totally
listen, Ben
agree.
Shanuta, everyone,
No,
we're going to take a pause here. We'll come back and talk about the smaller independent pharmacists right after this break. Don't go away. Well, we're working our way through the war between the government and pharmacists in Ontario, hoping that truth is not the first casualty of that war. And Ben Shanuta, I want to come back to you as the president of the Independent Pharmacists Association in Ontario to tell us, and this was just happened before the break, the differences between the small pharmacies that you represent and the big monster chains.
The major difference is the small pharmacy dependent more on prescriptions. So out of my revenue or my colleagues' independent pharmacies' revenue, is more than 80% of our revenue comes from prescription. If you compare this to the chain drug stores, it's something like 45% of the revenue comes from prescription.
And the rest is chips and whatever.
Yeah, the other part of the store.
Yeah.
For me, if this regulation goes through, I will be very badly hit on my revenue side. I may be able to survive a year and a half, but I will basically be forced to reduce my hours, lay off my staff, and I have to think very seriously of level of service I'm doing for my patients as well, if I would like to stay in business.
Well, percentage-wise, how much of your total revenue then, restate this for us, how much is your revenue going to decrease by? As a percentage, how much of a percentage of your revenue are you going to lose?
I have more than 50% of my prescriptions coming from Ontario Drug Benefit. So if the Ontario go ahead with this plan, you can say on the night of the May 15th, when I close my store, my inventory will worth, let's say, $100,000.
Yeah.
If I open in the morning, my inventory automatically went down to about $50,000 or $55,000. So without doing anything, only between night, I will lose something like $45,000 on my inventory.
And your argument is that's certainly not sustainable.
It is not sustainable for a small business like myself or like the 1,500 independent stores in Ontario.
Okay, let's go to the phones, get some more voices involved here. Here's Ian calling from Toronto. Ian, what do you think about this? Do you believe people will actually save money in some cases on generic drug prescriptions?
I'm persuaded by what I've heard that the government's plans to make changes will reduce the price of generic drugs and will increase access. I work with a lot of frontline healthcare workers, so folks who work in emergency rooms of hospitals, who work on hospital wards and who work in clinics, nurses and physiotherapists and so on. And I know that they're very supportive of this change. They recognize that the change is important for two reasons. One, because it will bring down the price of generics by 50%. And that means that the healthcare system here in Ontario will be that much more sustainable as people get older. And secondly, the current system for paying pharmacists allows generic drug companies to provide kickbacks to pharmacists in a way that is not transparent and doesn't necessarily protect the interests of patients. And a lot of that money isn't going directly into care. We can tell that